Hi, Dr. Pelto here. I want to go over a little bit of a presentation that I use for patients that need an ultrasound in the office. There's a lot of different diagnoses that I do ultrasounds for, and I use this little presentation to explain the ultrasound prior to doing it in the office. So I thought this might be helpful for you if you're going to have an ultrasound or if you do ultrasounds in the office. I use this little thing just to kind of explain the anatomy when I look. So something that's hypoechoic is black, something that's hyperechoic is white. And these are the main diagnoses that you can see here. I don't have to read them for you that I do for the ultrasound. So let's go right into it in order. So the first one that I go over with my patients is plantar fasciitis. And I explain that on the ultrasound, everything is flipped upside down right here. And I also show where the fascia is in the area of thickening. It's less thick here and it's more thick right there. I also have some normal values up here. So when I measure it, I can show them that theirs is usually larger. I explain a little bit about the spur here, and this is a head-on view. So this is the slide that I used to explain prior. Then I'll do the ultrasound and show them their actual images. And then I actually have this thing called a plantar fasciitis checklist. And this is how I treat plantar fasciitis, looking at the x-rays, ultrasound, MRI, and different types of treatments to reduce inflammation, reduce tightness, stabilizing your foot. So that's the first one with plantar fasciitis. The next one is going to be a plantar fibroma, which is a little bit different. I have a similar picture to the plantar fascia just to show that it's upside down, and a picture of a plantar fibroma right here, and also some thickening within the fascia. So these are some pictures of fibromas that I show, and also just how I treat it. Once again, very similar to plantar fasciitis in terms of the treatment plan for the plantar fibroma. You can read these. I don't have to read these to you either. So there's some other treatments for plantar fibroma. The next one, Achilles tendonitis, is another one that I use the ultrasound for. An example of the Achilles tendon, just the regular anatomy. This is a cross section here showing some defect here, some areas of inflammation and some uptake, and also some normal values of the Achilles tendon. And then here's some the other types of images right here of the Achilles tendon. And then the Achilles tendon checklist, just different types of treatments that I use for Achilles tendonitis. And usually I'll go through these with patients. Okay, we've tried this, this, and this is what we're going to do next. So here are some treatments for them. Haglins or a spur in the back of the heel region. I might do the ultrasound back there as well. Here's some normal ranges. Once again, this is of the Achilles, but we're going to measure that and see if there's any spurs in the back of the heel region, and different types of treatments with physical therapy, heel lifts, things like that for the Haglins deformity. Next, you're going to find something on sesamoids right here. Here's just showing the anatomy of the sesamoid structure. So you're going to look at the flexor hallucis longus, which is the tendon that pulls down the tendon of the flexor. Also looks at the sesamoids that would be on each side. So you can look at the flexor hallucis right here, and then the sesamoids on either side. Possible sesamoid fracture, what it looks like on ultrasound, and inflammation of the flexor hallucis longus. Once again, different types of checklists that I use for sesamoiditis or a fracture, how I treat that. This is helpful. These little checklists help things. The peroneal tendons, looking at the peroneal tendons, what they look like with some swelling around them, some thickening of the peroneal tendon, effusions around the area of the tendons, and just how they look with an ultrasound with some swelling, and then how I treat peroneal tendons with my little checklist of treatments of things that people can try. Next, ganglion cyst. I can show them what a cyst looks like, different areas, and what they look like on ultrasound prior to doing the ultrasound. And then my little checklist of how I treat ganglion cyst right here. Os trigonum. Os trigonum shows this is an ultrasound guided injection to the back. So an os trigonum injection, kind of showing a little bit about what it looks like. And a lot of times I use the ultrasound for ultrasound guided injections. Also, I use it to show the anatomy, and then I'll do maybe shockwave or EPAT therapy. Here are my different types of treatments here for the os trigonum. Neuromas as well, something else that I look at under ultrasounds. Here is a neuroma in that area, kind of showing this is an older generation neuroma picture. Here's one of a newer one. You can see it kind of popping up in the inner space, kind of showing the anatomy, and then my neuroma checklist of how I treat things with the neuromas. Posterior tibial tendon, once again, showing the posterior tibial tendon, and then the thickening and the effusions around the area or inside the tendon. Some pictures there. And then flat foot or posterior tibial tendon dysfunction, the checklist of different types of treatments for that. Plantar plate, something else that I use it for, kind of showing the anatomy of the plantar plate, how there can be tears or injuries or defects in the plantar plate around that region. And very similar to plantar plate is metatarsalgia, so showing some areas of inflammation around the metatarsal head or the area just proximal just before that. And then also how I treat different types of forefoot pain. So forefoot pain can be metatarsalgia, plantar plate tear, capsulitis, a lot of different things, but the treatments are pretty similar. And so those are the types of treatments that I have for this. If you're interested in learning more, they're underneath this video. There's a little link. It's to one of my pages on Thinkific, and on there you can find some more of these resources to help treat your patients if you're a doctor, or if you want to learn more, there's a lot of helpful information there. Okay, thanks.